Welcome back to another episode of Senior Matters Matter, the show where experience counts, wisdom wins, and getting older just means getting better at the game of life. I'm Bob G., your host, and today we're jumping into one of the most talked about and, let's be honest, often head-scratching topics in the world of retirement, Medicare. Now, before you yawn and throw your coffee at the speaker, hang tight. This episode isn't about throwing a dictionary of insurance terms at you. We're going to keep it real, relevant, and actionable. Whether you're already enrolled, just hitting 65, or helping a spouse or parent navigate the maze, this one's for you. Part 1, Medicare. It's not one size fits all. Let's start with the basics, and here's the first truth bomb. Medicare isn't a single plan, it's a menu. We've got Part A, hospital insurance. Most folks get the premium free if they paid into Social Security long enough. Covers hospital stays, skilled nursing, and some home health. Part B, medical insurance. Think doctors, outpatient care, preventative services. Part C, Medicare Advantage. More on this in a minute. Part D, prescription drug coverage. And here's where the fun starts, or confusion. You can stick with original Medicare, Parts A and B. Add a Medigap policy to help with out-of-pocket costs and bolt on a Part D drug plan. Or you can go with a Medicare Advantage plan, Part C, an all-in-one alternative offered by private companies. Which one's better? It depends on your lifestyle, health needs, and risk tolerance. Part 2, strategic choices. Not just sign and done. Here's what smart seniors do. They treat Medicare enrollment like a financial decision, because it is. Action tip number 1. Compare before you commit. Use Medicare.gov's Plan Finder tool. Look up Advantage and Part D plans in your zip code. Compare premiums, out-of-pocket caps, provider networks, and prescription coverage. Don't assume the lowest premium is the best deal. Action tip number 2. Know your enrollment windows. Initial enrollment period, 7 months around your 65th birthday. Miss this and you could face penalties. Open enrollment. Every year, October 15th to December 7th. That's your chance to switch plans, and it's worth reviewing annually. Plans change, and so do your needs. Action tip number 3. Be wary of free perks in Advantage plans. They might dangle gym memberships, dental, and vision. Sounds great, right? But check the network. Some plans are very narrow, and out-of-network care can cost you big. Action tip number 4. Don't forget Medigap if you're staying with original Medicare. These supplemental plans help cover the 20% that Medicare doesn't pay. But here's the kicker. You have a one-time guaranteed issue right when you first enroll. Miss it, and you could be denied or charged more later. Part 3. Common pitfalls and how to dodge them. Let's save you some future headaches. Pitfall number 1. Not signing up for Part B on time. If you don't have employer coverage, you'll pay a lifetime penalty. Pitfall number 2. Picking a plan based on a friend's recommendation. What works for Bob might not work for you. Pitfall number 3. Ignoring prescription coverage. Even if you don't take any meds now, delaying Part D can also lead to a penalty. Pitfall number 4. Assuming Medicare covers long-term care. It doesn't. That's a whole different ballgame. Part 4. Smart moves for maximum peace of mind. Let's talk optimization. Schedule your annual Medicare wellness visit. It's free, it's preventive, and it helps spot issues early. Set a calendar reminder every October to re-evaluate your plan. Health changes, and so do provider networks and drug formularies. Consider using a Medicare broker. They can help you compare plans. Just be sure they represent multiple carriers and aren't pushing one company. And here's a golden nugget. If your total income is below certain limits, you might qualify for help, even if your assets look solid. Look into Medicare savings programs and extra help from Part D. These can save you thousands. Wrap up. Navigating Medicare may feel like driving through fog at first, but with the right map and mindset, you'll find your lane and cruise comfortably. Remember, you don't have to do this alone. Tap into your local SHIP, State Health Insurance Assistance Program, your pharmacist, or even a trusted family member. Just be selective about who's giving advice. Next time on Senior Matters, we're tracking something that's just as personal as your healthcare, your legacy, your way. Planning ahead for the things that matter most, from wills and trusts to values and stories. Until then, stay wise, stay curious, and as always, you matter because seniors matter. I'll see you again soon. Bye-bye, and thanks for reading, watching, and listening.